AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, welcome. I'm Lorena Anderson, your life and energy coach, and this is You and Your Doctor, where we teach you how to live healthier and longer. And it's being produced by AMP2 TV and proudly sponsored by allcountyhealthcare.com, where patients are the heart of their business. And we really want to say thank you to All County Healthcare for sponsoring this, because what is happening, you're being taught and educated by the best and most competent professionals and experts out there in the field. And it is so important to be able to identify what you might need in terms of healthcare so that you can get up and running and feeling alive and healthy again, just in case you might not be. The other thing that we want to do also is make sure that you have the insight and knowledge in order to make those critical decisions when it comes to your insurance as well. So, without any further ado, it's really great to have you here. If you want to call in, we have two fabulous guests. We have a dermatologist and we also have a plastic surgeon tonight. So if you want to call in, please do so at 888-565-1470. And we would love to answer any of the questions that you might have. I also want to welcome our Facebook friends on All County Healthcare. It is wonderful to have you. And if you have any questions about any aftercare whatsoever for All County Healthcare, please give them a call at 888-717-7170. Ask for Maddie. She would love to answer any of the questions that you might have, because sometimes that can be really, really confusing. And they've been in business for a really long time, so they'll be able to help you. So without any further ado, I would love to introduce our first guest, Dr. Weiss. It is wonderful to have you here.
Oh, thank you for having me.
Yeah, please, you're in the field of dermatology.
Yes.
So tell us a little bit about what got you started.
Well, it's an interesting question. So when you go to medical school, you're sort of confronted with everything. Do you want to go to pediatrics, OBGYN, cardiology? Those tend to be where the majority of people end up. Mm-hmm. But what I found over the time that I spent in the early part of medical school was there was a real excitement both about immunology and oncology. So diseases that are cancer and diseases where the body may be attacking itself.
Oh, wow.
And dermatology gave me an opportunity to pursue both of those interests. And during the time that I've been a dermatologist, I've had the opportunity to see tremendous advances in treatments for both of those categories of disease.
Well, let's talk about the first category of disease where the body attacks itself.
Sure.
Tell us a little bit about that and how dermatology works in helping individuals that happen to have that type of disease.
So when the body's attacking itself, we call that an autoimmune disease. And the most common autoimmune disease in dermatology is psoriasis.
Oh,
and so psoriasis is often seen by others as these red, scaly plaques on the chest, the arms, anywhere on the body. Mm-hmm. Some people have it in the scalp, and it will come off as more like dandruff, but in fact, it's really one of these autoimmune diseases.
Wow.
And over the last 10 to 15 years, what we've seen is this advance in understanding how the disease works. So it wasn't just a disease of the skin, but really one of these immune-mediated diseases, and such treatments have been developed targeting that, where now there's really absolutely no reason for anybody with psoriasis to suffer from those plaques with the amount of medications that we now have today.
That is absolutely incredible, because I remember, back when, where people were going to the Dead Sea.
Correct.
And they were bathing and soaking in the Dead Sea so that they could, heal the psoriasis. Did that have any validity to it, or was that more of a placebo?
It definitely had validity to it. I mean, the sun exposure that you can get at the Dead Sea, as well as the salts in the water, can be therapeutic. But even with the price of medicines today, it's still cheaper than a flight to Israel. So there really are these opportunities now that we don't need to sit there and soak and spend 8 hours outside and have all the problems that come from that. with the medicines that are available to us today. But that was probably one of the better treatments 10 to 15 years ago before these new advances.
So do you see that there's a cure on the horizon?
Well, I'm not sure that we're going to find a cure to an autoimmune disease, largely because of how different it is in everybody. But we've gotten to the point where our treatments will clear 90+% of the people, up to 90% of the disease. So, I mean, we're not at a cure, but we are at a place where we can control this to the point where it's really almost unnoticeable with a shot, maybe every other week, all the way down to once every 3 months.
Wow, that is really amazing, because I do remember, it used to be quite grotesque to see, the psoriasis all over elbows and arms and everything. And it was really difficult for the individual to deal with it, because it really cut into their self-esteem and the feeling of being confident. And so that's really great news. Right. I love to hear that.
Right. You really hit on the major point, that individuals who suffer from psoriasis suffer in ways that those of us who don't have a skin disease can never understand. I mean, people walk around with high blood pressure and they walk around with joint pain, and they're in a great deal of discomfort. But it's not to the point where anybody else realizes that. You're not going to see anybody and say, oh, you must have arthritis or you must have high blood pressure. But if you have psoriasis, as you pointed out in your own words, it's grotesque. And that's how these people feel.
Yes.
And the impact that it has on social functioning, on intimacy, on the ability to do things as simple as go out and play sports, is tremendous.
Yes.
And so one of the great advances of these medications is that it restores an individual's sense of self-worth, so that when they do go outside, they don't need to worry about people pointing fingers at them, laughing, or wondering if they have some sort of deadly infection that would be transmissible.
Oh, well, I'm telling you, that's fabulous, because, I am familiar with some individuals that have had that, and it was just so devastating for them. I mean, they really became hermits, because it was hard for them to go out and socialize and feel happy and proud of themselves. We've got so much in our self-image, and when something like that happens, it's really debilitating. So, boy, that's wonderful. That's great news. So, and tell us about the other piece of disease that you were talking about.
Right, so skin cancer.
Yes.
So the oncologic diseases within dermatology. Skin cancer is the number one cancer in the United States. Non-melanoma skin cancer affects 1.6 million people every year. There are 62,000 melanoma skin cancers. So it's not something to take lightly, and it's something that we've seen grow over the last decade.
Well, I heard that we're on epidemic numbers right now.
Correct.
And do you think that it's just from sun?
Well, in large part, so non-melanoma skin cancer, so basal cell and squamous cell skin cancers, are largely sun-related. There are some genetic components. There are some other factors that play into it, but 90+% of those can be directly related to sun exposure, largely sun exposure that was accrued in the early years. So it's not yesterday's golf game that led to tomorrow's squamous cell cancer. It's really what you did when you were a child. Often the stories are told of oil, iodine, and reflecting mirrors.
I would know all about that, because I was one of those. But I also figured, well, I live in Chicago. Right. And I grew up in Chicago, and there's only 3 months of summer, and I could only go out, during 2 months of it. So, my chances were lower. But, the more that I'm hearing about it, the less that has any validity to it whatsoever.
Right. That is one of the big problems, that even in short bursts, like you're describing, and sometimes that can be even worse, because people in that 3 months want to get a year's worth of sunshine in, as opposed to your Floridian who can get a little bit every day.
Yeah, I was really good at that, by the way. Yeah, the very first day, I mean, it hit Memorial Day. I was out at the beach. I lived right next to Lake Michigan.
Sure.
So I was out at the beach, and I didn't come in, I don't care how cold it was. And I used to go in the water, too. Oh, you got to have the water along with that. And the water was 50 degrees.
Right.
I know, it's crazy.
Going into Lake Michigan.
I couldn't stomach that today, but no, I remember. And the whole day I would spend out there, and then I would get a sunburn. I would peel, and then for the rest of the summer it was fine. It just turned brown. Well, something, thank God for advances in knowledge here.
Right.
And I just want to take a moment here. If you have any questions for Dr. Weiss, please give us a call at 888-565-1470. we would love to hear from you. If you have any questions about, something that you might find on your body and you're unsure about, I think we'll discuss a little bit about that.
Right.
how to be able to identify the melanoma
Right.
and non-melanoma. And those various types of diseases. I think it's really, really important, and especially, for our 60 plus generation, because no one knew about, how dangerous the sun could be and accumulated sun exposure until today. And now we're starting to see what the effects are. So please give us a call. We would love to hear from you. And I'd also like to say thank you again to All County Healthcare for sponsoring this show, You and Your Doctor, teaching you how to live a longer and healthier life, because they have really brought in some of the top professionals in their field in order to help educate us. And I'd just like to say thank you. And thank you, Doctor, for coming in as well, because I really appreciate the time. I know how busy you are, so I really do appreciate the time that you're spending with us.
Thank you for having me. Happy to be here, and obviously educating the public is part of our mission as physicians.
Absolutely. Absolutely. And thank you very much for doing that. So tell us a little bit of what we might need to look for when it comes to some of the skin cancers.
Sure. So when we think about melanoma, we think of what's called the ABCDs. So A being asymmetry, B being borders, C color, and D diameter. So let's take each one at a time.
Okay.
So asymmetry, meaning if you were to look at a mole on your body, so a spot, for lack of a better term, does the left side look like the right side? Does the top look like the bottom? If there's a difference in one half versus the other, we consider that lesion to be asymmetrical, and that's a warning sign that the lesion is dangerous and needs to be biopsied by your dermatologist.
Okay.
Borders. Are the borders perfectly round or are they jagged? If we're seeing borders that are not round, that again is suspicious.
Okay.
Color. Is it uniform in color? Is it a light brown? Is it black? Is it red? Does it have a stigma of bleeding? Those would be bad signs and really warrant a visit to the dermatologist. And then finally, diameter, and we think about that as, is it bigger than the head of a pencil?
Oh, okay. Well, that's interesting. I don't think I had heard that one before.
Right.
But, okay. Anything bigger than the head of a pencil, I'll be aware of.
Right.
And especially, a lot of the golfers.
Correct.
They've been out there for, many years and enjoying the game and everything. And their sun exposure, I mean, it's a joke. The golfer's tan.
Right.
So it starts at this point and it goes all the way down, and then there's the line around the neck.
Right.
and even on the legs, you can see where their socks stop.
Right.
So please keep your eye out. If you can't check the rest of your body, have your wife check it or a significant other. But then get to a dermatologist. Well, call Dr. Weiss. Tell us how we can get a hold of you.
So you can reach me by phone at 561-372
Slow.
7546. Again, 561-372-7546. Or online at www.weisskininstitute, all one word, .com.
Excellent. And where are you located?
So we're located next to the West Boca Medical Center at 441 between Glades and Palmetto. It's 9980 Central Park Boulevard.
Okay. Excellent. So please, by all means, give Dr. Weiss a call. Any questions that you might have, or you can call in the radio station right now because we're streaming live. Hello. So, something. Tell me a little bit about the sunscreens.
Sure.
Because I've heard varying things about the sunscreens, and in terms of also being able to get the correct amount of vitamin D when it comes to that. Because does the sunscreen block the vitamin D from reaching the body and absorbing it into the skin?
Sure. So those are two great questions and very important to be addressed. So the first, in terms of sunscreen, there is a lot of noise out there regarding the, quote, dangers of sunscreen. And what we found is a lot of that research isn't the best, for lack of a better way of putting it. There are some ingredients in chemical-based sunscreens that certain working groups have decided could be pro-cancer forming, and thus they've used that to say you shouldn't be wearing a sunscreen. Unfortunately, some of that same ingredient we also use as a cancer treatment, so it's not clear that it really is either pro or anti-cancer forming. But what's important in a sunscreen is not necessarily the chemical ingredients, it's the physical blockers. So a sunscreen that you use should have either zinc or titanium in it. And all you need to do is turn to the back of the bottle where it will have the active ingredients, and it should list either zinc oxide or titanium dioxide. And without one of those two ingredients, it's really not a very good sunscreen.
Well, that's really good information. Okay, because you don't know what to look for.
Right.
You go into the store and they've got 10, they got 20, 30, 40, and I've already heard 40 and 50. There's no use for it because it's redundant, and I'm like confused.
Right.
So you need those two specific components in the lotion to block the is that the UV ultra rays and what is it, the UB ultras?
So either one of those two ingredients would be critical because they are physical blockers. Everything else is a chemical blocker, meaning it has to absorb into the skin and then do its job, which is why you often hear about apply your sunscreen 20 minutes or 30 minutes before going out so that the chemicals can do their work. You don't have that same risk profile with the physical blockers, zinc or titanium. And by using that, you can then go out immediately and play golf or play volleyball, whatever you'd like to do.
But does it leave like this white film all over your face?
They're much better than they used to be.
I've seen ghosts before,
So now we micronize it, so it actually blends in quite well.
Oh, does it? Okay.
So you don't have the same problem. So we have a 17% titanium dioxide sunscreen that we helped formulate to address that particular problem, where people did not like that, and so we wanted to make sure that our patients would have a sunscreen that in fact was not going to be noticeable regardless of your skin tone. So be it that you're sort of super, super white, Northern Ireland demographic, or dark-skinned African American, but all the spectrum has no real complaints about that.
Let me just make sure I'm hearing this right. So you're saying that you formulated your own sunscreen?
Right.
Wow. What's the name of it?
So it's just branded under our office name.
Okay. That's wonderful. And then it has the ability of being able to blend in with your own skin tone?
Yes.
Wow. The other thing that I had also heard, that's fabulous, So if you need some really good sunscreen, this is the man to follow. Excellent. The other thing I also heard was that there was a sunscreen out there that was purple, and then once it hit the skin and everything, and you started blending it in, then it went away. But at least then you could see where you were maybe missing some places.
I had not heard that, so I mean, you can do a lot with formulation. So it would sort of start out as purple, and then that color form can break based on the application. So it would be possible. I'm not aware of that particular one. But as you pointed out, you can go to the store and find shelves of sunscreen.
Yes. And exactly, I mean, that was many years ago. One of my girlfriends ended up having one, and I think she had gotten it from Europe.
Right.
And I thought that was really interesting because a lot of times, you're putting this stuff on and you don't know whether or not you've, hit every single spot.
Right.
It can be a little difficult there. So who do you majorly see in your office? I mean, we talked about the two different types of diseases and everything. Who else do you end up seeing in your office?
So I think it's large part individuals with psoriasis and these autoimmune type skin conditions, as well as the skin cancer. And then the third part would be cosmetics. So individuals who are looking to improve their appearance either because of sun exposure early on or just trying to halt the signs of aging as we all try to hold on to our youth.
Yeah, I know. I'm fighting it too. Hey, yeah, okay. I'm not going to, I'll tell you later how old I am. Okay. Well, that's wonderful. So what are some of the things that you end up using in your office then in order for the anti-aging whatever?
Sure. So the philosophy in the office is largely that you need to sort of look at things as a treatment ladder. So you want to think about your general topical products that you should be doing as preventive maintenance on an everyday basis. So the creams, the serums, the lotions that are really going to help minimize further damage and help reverse the damage that was done. Then we take it another step forward and say, are there ways to use injectables? So Botox, Restylane, Juvederm, those types of toxins and fillers that can lessen the wrinkling as well as improve some of the sagging and decreases in volume that happen as we as we mature. And then lastly, lasers. So the laser really is a great way to reverse sun damage. It will both help pigment in the skin and will restore some of the fine lines and wrinkles that happen to all of us.
Gotcha. And what kind of lasers are you doing?
So largely the CO2 laser, which is a fractional ablative laser to give us the opportunity to reverse sun damage, reverse the signs of aging, but quicken the healing process because of its fractional nature.
Gotcha. Very interesting. So please let the audience know again how they might be able to get a hold of you.
Sure. So again, I can be reached by phone, 561-372-7546, or online at www.weisskininstitute.com.
Excellent. And you're located where?
Next to the West Boca Medical Center, off of 441 between Glades and Palmetto, 9980 Central Park Boulevard.
Excellent. So, don't mind me, but how long have you been in business? Because you're looking awful young, and I'm thinking you might be using your own...
Practice what I preach.
Yeah, exactly.
So I've been there for almost 10 years now, and then I was in California previous to moving back to Florida.
Okay. So how long have you been a dermatologist?
So I've been a dermatologist now 13 years.
Wow. Okay. Well, good for you.
Thank you.
And whatever you're doing, keep up the good work.
Thank you.
It's looking good. Well, what are some of the other things that we might need to know? Some of the other myths, possibly, that we've been told.
Right.
Help us out.
So again, I think in large part it is this notion of sun protection and what you really need to do and how you need to do it. Getting back to your original question we didn't get to with vitamin D.
Yes. Excellent.
I think there's a role for having vitamin D, but there's also this need to make sure that we're not creating further damage with sun exposure. And so there really hasn't been a lot of great links between using sunscreen, blocking that exposure while being out, and decreasing your vitamin D levels. And so I wouldn't use I need my vitamin D as an excuse
I use it all the time.
not to wear your sunscreen or sun protective clothing. Right? So I think that really we need to make sure that we're protecting ourselves over the long run.
Well, and I have heard that vitamin D is a lot of people are lacking vitamin D,
Right.
and it's really upsetting their health.
Right. And that's, I think, the part that we still need to understand a little bit more, because there are, as you pointed out, a lot of people that are lacking in vitamin D when we're doing these lab tests, but we don't necessarily know what the clinical significance of those lab tests really are. And we're not being able to draw straight lines between decreases in vitamin D and any particular decrease in health status. And so that's why we want to make sure that we're not using that as our excuse for saying, well, I don't want to put on sunscreen, I'm not going to wear a hat, because we do have a very direct correlation between sun exposure and skin cancer.
Gotcha. So, I mean, do you recommend then supplements then for your patients?
Right. Again, vitamin D with calcium as a general supplement. I think that most people should do that. You mentioned the 60-plus crowd. And
Yes,
I think
absolutely.
that's a patient population that should be doing that just for good bone health.
Yes.
And so making sure that their bones remain strong so they continue to play golf long through their 80s and 90s.
Yeah.
You want to be doing that. So supplementing your vitamin D with pills is probably your better bet.
Gotcha.
And then wearing your sunscreen and hat.
Gotcha. And also exercising. Hello, everybody out there. There's no better way of keeping those bones and the muscles really healthy and everything than through exercise. And many years ago, I was a fitness trainer. So I used to work with the geriatric population and found that it's absolutely necessary, because we can become so stagnant, especially if we're dealing with any kind of pain or whatever. Our movement might become more difficult, but you still have to make sure that you are exercising those muscles, moving those joints, having the ability of getting up and out of your chair. And that's one of the things that I always tell everybody.
No, exactly. I mean, diet and exercise, I think, are key,
Yes.
regardless of what organ we're dealing with. I mean, I think it's as important for people who have skin disease, as heart disease, just generally to feel well and to maintain a good health status. Diet and exercise are critical.
Absolutely. And you're right, at any age, but especially for our elder population, because I just noticed that a lot of times, if it seems a little too hard, they just rather sit down and watch TV, and
that happens at any age. We're not gonna hold that to the senior
really,
demographic.
Doctor?
I think I'm more worried about the millennials than I am about the seniors in terms of being active.
You might be right about that too. They seem to have a level of correlation there.
Right.
Okay, but with our elderly population, even if there were some of the not even assisted living, independent living places, and those were really, really good because they would have exercise classes, they would have yoga classes, they had swimming classes, so they really worked on maintaining that level of exercise and strength, and it's so important for the bones too and their posture.
Right.
So, well, one more time, please tell our audience how we can get a hold of you.
Sure. So again, by phone, 561-372-7546. Or online, www.weisskininstitute, all one word, .com.
Okay, great. It has been such a pleasure meeting you. Thank you for coming.
Oh, I appreciate having me.
Yeah, it was wonderful. And we're going to go on a commercial here. So I don't want you to leave because we've got someone else also. We have our plastic surgeon who's coming in next. And we just cannot, we're so excited to have both of you here. And the other thing, too, that's really important is that, dermatology and plastic surgery, they work hand in hand.
Yes. So
thank you again. And we're going to break for a commercial. Stay tuned. Don't leave. And we'll be right back.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hey, here we go. Hi, welcome back to You and Your Doctor, teaching you how to live a longer and healthier life, being produced by AMP2 TV and proudly sponsored by All County Healthcare, where patients are the heart of their business. I just want to take this moment to really say thank you to All County Healthcare because they have brought in the top professionals here that can help teach us what to look out for, which doctors they might need, different information about Medicare. And also, we even had somebody on from reverse mortgages. So, go on allcountyhealthcare.com and you can archive. All of the shows are archived on there. You'll find us streaming live every Tuesday from 6 to 7. We welcome any calls that you might have for us at 888-565-1470. And to our Facebook friends on All County Healthcare, that telephone number is 888-717-7170. Ask for Maddie. She would love to answer any questions that you might have concerning your healthcare needs. So without any further ado, I would love to introduce to you Dr. Lisa Learn. She is a board-certified plastic surgeon, and I have to admit, she's also one of my girlfriends, my best friend. So I'm just thrilled to have her on the show today.
Oh.
So welcome.
Thank you for having me.
Oh, yeah, thank you for coming. It's wonderful to have you
My
here.
pleasure.
Wonderful. So tell us a little bit, what got you into plastic surgery? What had you going into that field?
Well, when I was going through my training, I had several options that I had thought of. OBGYN, because I really enjoyed bringing a new life into the world. And then I was interested in surgery. You know, you go through that as a resident. You flip-flop and until you find the thing that you really, really, really love. And in fact, I had a rotation that I had to do, and I'm like, well, I'll do plastic surgery. That sounds kind of fun. And I was blown away.
Really?
I watched a surgery, and I thought that the patient was, kind of being filleted open, without getting graphic. And then zip, 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 zip. Everything was back together, and it was perfect. And it's like I loved the creative nature of plastic surgery.
Oh.
Yeah, I love that. I love to be able to mold and shape.
So tell us, where does the name plastic come from anyhow?
What a great lead-in, right?
Yeah, you're wonderful.
Yeah. Plastic surgery is not necessarily a surgeon putting plastic in a patient, which some patients believe. They're like,
and some and I've seen some patients that are a little plastic there, babe.
Plastic surgery actually comes from the Greek word plastikos, which means to mold and shape.
Oh,
okay. Yeah.
Okay.
So we work with a lot of soft tissue, some bony work, things like with the bones, but mostly we're molding the soft tissue to create a new envelope for the skin.
Okay. And it sounds as if, you have to have some level of creativity. And one of the things that I do know about you is that you are an artist. I've seen your work before, and an absolute artist.
Thank you.
And what I really enjoy is that it doesn't matter whether the patient is awake or asleep, gone. What's so important is that you treat that patient, whether they're conscious or not, with the same level of dignity and care and tenderness that you would if they were totally awake and they were watching the whole thing from, as you're doing it. So, I just want to commend you for that. I mean, I have seen your work, and it is amazing. It is amazing, especially in the reconstructive arena, for the cancer patients, breast cancer patients. Can you expound on that a little bit?
Oh, sure. Plastic surgeons do reconstruction for breast cancer patients after they've had their mastectomy. A lot of things go into that interview with the patient. The patient's just been diagnosed with breast cancer, and within days to weeks after their diagnosis, they're in to get more information about reconstruction. They have all this information about their cancer, which is concerning, but then, here's another thing to add on to their worries. So we try to make it as painless as we can, give them their options in a very succinct manner so that they know they can easily decide what's best for them. So they come to me, and of course options include using their own tissue versus a prosthetic like an implant. But that's everything we go through, in the interview. And going back to what you said about, treating the patients awake or asleep the same, my motto is, if I wouldn't do it for my family member or myself, I won't do it for my patients. So I like to think I treat my patients as family members or friends,
Yes, you do. Yes, you do. You have an amazing...
For my long-lost sister.
Yes, absolutely. You have an amazing bedside manner,
thank
and
you.
that's one of the things that I always hear, a lot of your patients talk about is that you're warm, you're gracious, you take pride in your work, of course, and but they feel so confident. When you're working with them, they they feel so safe, and they also have this feeling of it's going to be okay. It's going to be okay, and you're going to take care of it. So tell me some of the other things that you end up doing in terms of the reconstruction piece of it.
Or with reconstruction, I also do a lot of skin cancer
Okay.
removals. Skin cancer removals, repairs. Patients who have had Mohs surgery, where they take out the cancer and test it sequentially. After that, they may need reconstruction, so I'll take care of that also. I do also wound care for the hospital.
Okay.
So patients who have bed sores, once we have optimized them physically and mentally, then we are able to take them to surgery and repair their bed sores and keep them in such a condition that doesn't happen again.
Oh, that's amazing.
Yeah.
So you're just not doing the reconstruction in terms of whether it's breast, the face, because I there are some other situations I think that I had seen where you're working on the face and repairing the face.
Oh, sure.
But also the wound piece of it too, and that's really important.
Yeah, I do scar revisions also.
Oh,
Patients
okay.
will be involved in motor vehicle accidents, and they'll have horrendous scars from glass shards and things like that. And I repair those also.
That's really fascinating. So you're really quite diverse. It's just not anti-aging, but it includes anti-aging. So tell us a little bit about your anti-aging processes. What do you do to help us stay young?
Yeah, absolutely. Well, besides encouraging healthy living and exercise, of course, we do some things to help out. Fillers, neurotoxins. Neurotoxins are Botox, Dysport, Xeomin, those kinds of things. They paralyze the muscle temporarily so that you don't use them to make the lines worse.
Okay.
So we use that.
So it softens the lines.
It softens the lines, and after time, it really softens the lines. So if you're consistent with it and you come in, unfortunately, it's every 3 to 4 months, but it's completely worth it because you can completely get rid of lines that have been there for years.
Yeah.
And then we have fillers. Fillers are nice to fill in, some lines that are a little bit too deep for Botox, or maybe on the lower face. We kind of use the fillers done on the lower face, the Botox and Dysport and everything on the upper face, but can be used both. But then the fillers kind of fill in, just make things a little bit softer. It's when people have had too many fillers, that it's time that they need to back off because they no longer look like themselves.
Right,
And all we want to be is a better version of ourselves, not a better version of somebody else.
Exactly. Or a better version of the filler.
Yeah.
Oh,
Your
goodness.
filler looks great.
Oh, yeah. Well, can you imagine how many times I've had it done? Or the big lips, I've seen some of those. Oh, yeah, I know, it's kind of sad.
Know when to say when.
Yeah, or stop.
Or stop. Yeah.
Yes, exactly. So, what are some of the other, areas that you deal in? Especially, I know you happen to be one of the artists. I'll call you one of the artists in breast augmentations as well.
Yeah.
So share with us a little bit about
I
that.
do the full gamut of cosmetic procedures, starting head to toe, facelifts, eyelids, neck lifts, of course, breast augmentations, breast lifts, tummy tucks, liposuction, all that fun stuff.
Wow. So you are really shaping and molding, huh?
You betcha.
I like
To
it.
the best of my ability.
I like it. I think I'll come in.
Awesome.
Yeah. I just noticed a little reshaping needs to happen, but that's wonderful. How long have you been in your field?
16 years.
Oh, my goodness.
Yeah.
Where did you go to school?
I went to school in Missouri. I did my general surgery training for 5 years in Missouri. around St. Louis. Moved to Philadelphia for 2 years of plastic surgery training.
Okay.
And then I practiced in Pennsylvania, in Amish country, actually, Lancaster, Pennsylvania.
Really? Amish? Do they use any of your services?
No,
Oh,
I
okay.
only,
I was going to say.
only did the reconstructive part for them, when they had life-threatening injuries, but no. But practiced there for 13 years and then moved down here 4 years ago this August.
Wow.
Yeah.
God, it's been a long time, hasn't it?
I know.
Yeah.
It seems like it was just yesterday, though.
I know it does.
Yeah.
Time is going like crazy. I can't believe in another 3 weeks it's going to be Thanksgiving.
I know.
Yeah, I'm
Crazy.
like,
Yeah. And this is actually the time when people start rushing in for the holidays, so.
so you know something?
Thus starts busy season.
That's a perfect segue. Why don't you tell our audience how they can get a hold of you?
All right. Well, my office is located at Oakland Park in the Turnpike. You can call me at 954-380-8411. You can find me online at drlisalearn.com.
And that's spelled Learn. Learn.
Learn it and love it.
Yeah. I like that.
You like it? Yeah.
Yeah. Excellent. If you have any questions for her this evening, please give us a call at 888-565-1470. She would love to answer any of your questions that you might have. And the one thing I want to say is that there is no age discrimination here whatsoever. I mean, how old is your oldest client?
My beautiful 95-year-old patient who comes in for Botox and fillers is extraordinary. She doesn't look a day over 75. And so now, as she says, I look as young as I feel.
Oh, my God. That is amazing.
So as long as a person is healthy, there is really no age limit.
95.
Yeah. 95.
Oh, my goodness. Yeah. That's just incredible. So, I mean, do you see that there are more people, in their mid-50s, all the way up until, 65 and over? Are they taking more time in allowing their facial features, their body features, to match the youth that they feel on the inside? Do you see that growing?
That's just it. Everybody wants to look as young as they feel. I mean, 'cause let's face it, I'm, I won't say how old I am, but
Well, you could because you don't look it at all.
Old enough. But,
No.
I feel like I'm 20 years younger than what I actually am. So this happens to many people. And when my parents told me that this would happen to me, I said, oh gosh, no way. But here I am, And so, my patients are experiencing the same thing. My 60-year-olds feel like 40. My 70-year-olds feel like 50. So this is a way that they can personify how they feel.
Oh, I like that. Personify.
Yeah.
Absolutely.
Yeah.
Well, something, and I do have to give you kudos because she's also my doctor. And I will speak my age because I'm really proud of it.
You go, girl.
Because everybody's going, oh, you look like you're about 42, maybe 45. I'm 61. And I have got to tell you, I have never felt better in my life. And you're right, I feel so young. And now my face matches as well, along with my body, because I work out, I eat well, I exercise. But now my face gets to shine. It's almost as if there's a new glow to it. So
You're one of the most vibrant people I know. So now you're, this matches your energy.
It does. Being the fact that I'm a life and energy coach, I guess that it does match. So, one of the things that I have found, since, we can name names here, not only fillers, but you also use a product called Sculptra.
Correct.
And tell us a little bit about that and how that works, because that's one of the things that I end up that you've used on me. So
yeah, Sculptra works a little bit deeper than some of the other fillers. The way I explain it with patients is when you do a filler, you're just kind of filling in. You're putting caulk in the cracks, right? Sculptra actually works internally, and it gets your body going. Your body is what creates this new look. So you're putting like the equivalent of almost like an absorbable suture under the skin. Okay, and the body senses this, and it says, "Hey, I need to devour that absorbable suture. That's what I'm supposed to do." So you're body ends up bringing in all these cells. Well, it's your cells that create the nice, fuller cheeks, or your collagen that's come in to rescue you from that absorbable suture is now building, and it improves your complexion. I had a patient who had laser treatments for her acne pitting, okay? And she had resigned herself. It was so bad she would spackle her cheeks before putting on makeup.
Oh, my goodness.
So she did laser treatment. She resigned herself to the fact that she'd do laser every month for a while to see what she could get. And we had a nice improvement. But she was still having to fill in those little deeper areas. So she decided she wanted to do a little rejuvenation, and she did Sculptra for her cheeks. And I did a little down where the pitting was just to kind of smooth everything out. And she said that in 3 treatments of Sculptra, she had more improvement than 6 months of laser.
Oh, my goodness.
So, I mean, that's just a testament as to how it activates those cells in your body and brings them in to rescue your skin.
Wow. That is really amazing. That is amazing. Well, I'm a perfect example of that.
Yes. Everyone who tries it loves it. You have to be patient because you have to wait for your own body to create the results, which may take weeks, but it's not instant gratification like some of the fillers, but yeah.
Right.
Yeah.
That's true.
Yeah.
Well, that is very, very interesting. So give us a little bit more insight as to some of the newer state-of-the-art things that are coming out for us, because we had heard, some of the fillers. We're talking fillers now, okay? That there was just Juvederm and Restylane, and then all of a sudden now they're coming out with like a Restylane Silk, I think.
There's different ones, yeah. They're specific to different areas. Restylane Silk, I like for the mouth. There's Bellaterra, there's Radius. There's all these different, technologies, these different uses for these fillers. It's fantastic because there's new and improved ones coming out all the time. There are, if you want to get a little bit, more from your filler, you might go to Perlane. There are indications for Voluma, which can be used in the cheekbone to kind of recreate that youthful cheek and to,
pull up the skin too, right?
Decrease that sag that we get as time goes on. Yeah,
I see.
Yeah, and there's also, a lot of the new things involve treating fat. Everybody wants non-invasive fat removal, and those techniques are good and are useful in the perfect candidate. I see a lot of those procedures being done in candidates who are not the right candidate. And unfortunately, that's when you run into issues. But if it's done for the right candidate, the cool sculpting and the sure sculpt, they work nicely.
They do?
They can for the perfect patient. But for those that can't have those, liposuction is kind of the way to go because, you have guaranteed removal where you need it.
So tell us more about the liposuction. Where do you normally see that individuals need it, or is it? You tell me.
It's kind of all over.
Okay.
But, for female patients, what I see the most of is, they've had children, they've gotten into great physical shape after their children, they're very happy about their body, their arms are cut, they're looking very thin, and they're like, hey, I've got this pouch I can't get rid of. And I've worked out, and I've done crunches and crunches after crunches. Can you help me? So we call that the baby bump, right below the belly button.
I think I might know a little bit about that. I've always had a pouch with or without kids.
So that's one of the most common places that, my female patients in a certain age group will ask for, after they've had children. Mommy makeovers, and then we're kind of just resculpting a little bit of everything, a little breast augmentation, liposuction of the belly, kind of taking the hips down a little bit, recreating the waist, and maybe slimming of the inner and outer thighs. So that's
fabulous.
Yeah. Now for men, of course, there's the love handles. They want to get rid of the love handles. And so, that's very common for them.
Oh, excellent. Do you see a lot of men in your office?
Quite a few. Yeah, quite a few. It's surprising, the trend over the last, I've been doing this for 16 years. And at this point, I think I have a higher ratio of male patients than I've ever had.
Wow.
Yeah, and a lot of them come in and they're like, all these young guys are coming into the office and I'm in sales and I want to keep this going. I don't want my boss to look at me and think I'm, old and tired. So, they're getting fillers and neurotoxins.
Really?
Yeah.
Now, does it bother their beards at all, or does that not matter?
Well, usually if they have a beard, they're not too concentrated, or facial hair kind of covers whatever they think may look old. But, you treat everything around it, and
Oh,
or if they think they're going to shave their facial hair, then, of course, we have them do that, and
Oh, that's
fix them up.
Yeah, absolutely. Well, and there's so much competition out there for the men as well.
Yes.
And also, the men that are 50, 60 and older, it's not only typical for the women to want to freshen up their face, because that's what it looks like. It looks like you freshened up your face. And something, I as I said, I've seen your work, and so it's really quite amazing because you're so conservative, and it looks so natural, and nobody would ever know one way or the other. And they just look and they say, "Did you change your hair color? Did you get a haircut? Something's different." And I love it. I love watching that.
You can always add more. It's a little bit more difficult to take it away.
Yes.
So
yes.
Yeah, we start out conservatively. Go home, get used to it, adjust to it, and then they're back for more.
Yeah. Yes. Well, or not.
Or not. Yeah,
sometimes
that's their choice.
Yeah.
An individual choice.
So I'd just like to take the moment to turn around and say thank you so much to All County Healthcare for bringing these professionals on air to help educate us, to allow us to know what's available for us out there as well for anti-aging, and also to bring in the experts that are in their field, where you can feel safe and confident that they have your best interest at heart and they're going to take great care of you and listen to you too, which is a really amazing thing as well. That. How do they get a hold of you? And you've got some other exciting news, but I'm not going to break that yet. But How do they get a hold of you?
You can reach me in the office, 954-380-8411. My office is at Oakland and the Turnpike. And you can reach me at also, you can send me messages off of my website at drlisalearn.com.
Excellent. So you've got some exciting news coming up.
Yes.
Please share it with us.
Well, we have added a second location. We will be there on Fridays of every week, and it is located on Federal Highway between Oakland and Commercial Highway in Fort Lauderdale. And it's 3536 North Federal Highway.
Okay.
And my other office is 4900 West Oakland Park Boulevard, Suite 300.
Okay. And you're in Suite 100 over on Federal, correct?
Yes. 100 on Federal, 300 on Oakland.
Okay, great. That's so exciting. That's wonderful.
Yeah.
So if you're on the west side of Fort Lauderdale, the West Side office is fabulous. If you live on the East Side, she's there on Fridays, but it will be expanding from what I understand. Your hours over there will be expanding coming up in the future, correct?
In the future, yep.
That is wonderful.
Yeah.
That is very exciting. So, I just want to make mention that it doesn't really matter what age you are. What matters is how you feel. And if you're feeling like I do, I feel like I'm about 42. Every year I feel like I'm 42. I don't care how much older I'm getting. But it's so nice, though, to know, especially Dr. Lisa, that there's somebody out there that can help you look how you feel. And it's so, it gives such great comfort to, be able to be in your 60s and look like you're 40, because that's how you're feeling. And I love the fact that the men are coming as well. I mean, I think that that's really a major step that has really expanded itself, over the last.
That gender barrier, yeah, absolutely.
Yeah, that is wonderful. Yeah. Well, thank you so much, Dr. Learn, for being here with
My
us.
pleasure.
Yeah, I know how busy you are and opening up a new office and everything, but it has been absolutely wonderful to have you here. And again, anytime, you're more than welcome to come back again. And if any of our audience members, if you have any questions, you can still call in, and we'll end up getting you connected with Dr. Learn. So again, I would love to thank All County Healthcare for providing this hour-long show to help educate us on what is available out there to make us feel good and look good and feel happy, and also to live a healthier and longer life. So thank you so much. This is Lorena Anderson, the Energy Shifter, and we'll see you next week. Can't wait to see you again.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.